You all okay? Okay. Well, good morning. I'm joined this morning here at the Royal Exhibition Buildings Testing Centre and Vaccination Centre with COVID Commander Jerome Weimer and also neonatal intensive care nurse at the Royal Women's Hospital, Abby Gallop. And we'll talk a little bit more about Abby in a moment. But first, I wanted to provide today's statistics and information on both vaccination numbers and testing rates. And firstly, on vaccinations. As at today, we've got around 11% of Victorians aged 12 and above who have had their third dose. So that's 629,000 people who have had their third dose, and that adds to the 93% of Victorians who've had their second dose. And we'd really continue to encourage Victorians, whether it's your first, second or third dose, but particularly those Victorians eligible for their third dose as of today, to come to one of our state vaccination centres like this one here at the Royal Exhibition Buildings and come and get your third dose as quickly as possible. In terms of the numbers of people with COVID in our community, we have 516 people in hospital. That's an increase from the 491 people in hospital as at yesterday. 108 people of those people in hospital, 108 are in the intensive care unit with 24 on a ventilator, and the advice is that at present they're all stable. Very sadly, 2 people passed away yesterday with COVID, and our thoughts and sympathies are with their families and loved ones. 60,515 people got tested yesterday, and there's 48,287 active cases in the Victorian community. And just a little bit further on testing and on case numbers, we have 14,020 Victorians were diagnosed with COVID as of yesterday. Now, obviously, that is a large increase and equates to a very high positivity rate of the virus in our community. As the COVID Commander explained just yesterday, that is part of what is causing those delays to our PCR testing returns. And we really do continue to thank Victorians for their patience in coming out and getting tested within the eligibility for people who are required to be tested. Really thank them for their patience, and then also all Victorians for doing the right thing and following the required isolation and testing requirements that are in place. Now, look, I know Victorians can understandably focus on the 14,000 cases that have been recorded as of today. That is a large number. It's a big increase on what we've seen previously, but there's also another number that we're urging Victorians to focus on, and that's the 5.3 million Victorians who are either eligible over the coming weeks and months become eligible for their third dose. We have seen in the past few months Victorians get vaccinated in significant numbers, in world-leading numbers. We have 93% rates of double dose rates in our community, and we're now wanting to really push strongly into encouraging Victorians to come forward and get their third dose. And so just as we turned up to our state vaccination centres or to our local GPs or pharmacies to get our first and second dose, we're wanting Victorians to come out as they're now eligible for their third dose. And as of today, we know around another 1 million Victorians are eligible for their third dose, and that number will increase when the 3-month change comes into effect from the end of January, start of February. And so we know that our state-run vaccination centres do a terrific job, and that's also well supported by our GPs and pharmacies that we're working closely to encourage as many people as quickly as possible to roll up their sleeves and get that third dose vaccinations. And one of the people, one of our Victorians who is doing just that today is Abby Gallop. And as I said earlier, Abby is a neonatal intensive care nurse at the Royal Women's Hospital. Now, every day, 24 hours a day, Abby and her colleagues care for the most critically ill and vulnerable Victorian babies. They do a tremendous job helping work with babies and their families in this highly sensitive and very important environment. And that's why it's great that Abby is here today to not just protect herself, but also in her a very sensitive workplace setting, understanding understanding the role of getting vaccinated supports the caring role that she provides in that very sensitive hospital setting. And then also too, given the really important job that Abby has in our community, as she's out and about with family and friends, it also provides her a greater level of protection. And so we thank Abby not just for the work, as I said, she does every day, protecting and taking care of our sick little babies. It's also for getting that third dose vaccination that is really, really important. And this goes to the information we're providing today on our summer blitz for the encouraging Victorians, and to make it as easy as we can for Victorians to come forward and get that all-important third dose vaccination. We saw in 2021 at our state-run centres with GPs and pharmacies that great response to get us to the well above 90% double dose, and we're wanting to push on now in 2022 to see that third dose effort continue. And so that's why we're working with sporting clubs, youth groups, culturally and linguistically diverse communities, as part of more than 200 community organisations over this summer blitz to make it as easy as possible, whether it's through our state centres, pop-up centres that will be appearing around the state to help get Victorians that third dose vaccination. There's something like 300,000 people a week can be vaccinated in our state-run system, and that's supplemented by the GP and pharmacy system. So if you're eligible, please go and get your third dose vaccination, or if you haven't had your first or second one, there's always spots available for you as well. But we really want to encourage Victorians who have become eligible since as of today, with that change to the 4-month eligibility for the third dose, to come and get their vaccination. And so there's spots available on the coronavirus website. There's ways that the 1-800 number that people can make their booking, and there's also the clinic finder to help you find a GP or a pharmacy. So please, if you're eligible as of today to get your third dose, please do so. It's so important to protect yourself, to protect our community, to protect your loved ones, to protect your workmates, and most importantly, we know it's going to be play a critical role continuing to help us deal with the challenges that we are facing and continuing to face in 2022 with the ongoing circulation of the COVID virus in our community. To supplement my comments, I'll now hand over to the COVID Commander, Jerome Weimer.
Thank you, Acting Premier. Yesterday we saw 14,420 cases come forward, a positive case identified amongst 60,000 plus test results. It goes to an even higher positivity rate that we were discussing yesterday. It's almost 1 in 4 now of the cases that we're testing coming back as positive cases, putting more pressure, of course, on our pathology labs and our testing systems than ever before. There are now 48,297 confirmed active cases of COVID in our community, and we suspect, of course, with the growing number of people using the rapid antigen testing platforms, that the actual number will be far higher than that. All of us are now in an environment where we're seeing significant exposure to COVID in our everyday movements, and that's why all those sensible day-to-day measures that we've been talking about for the last few weeks are so important for us all to adopt. We are seeing, though, a continued intense pressure on our testing system, and particularly on our pathology labs. 3 out of 10 results are now coming back by the next day. That's a number that we'd normally expect to see as being 8 out of 10 or 9 out of 10 results. So if you're waiting for your results on day 2 or day 3 or day 4 or day 5, I'm afraid I'm going to ask you to continue to be patient. Our labs are working literally around the clock, having to work with a very high number of positive cases in the samples that they're processing. We will get to your results. As you wait for your results, I'm asking you to continue to isolate and wait for those results to come through. When your results come through from the labs, if you are a negative result, you'll get an SMS confirmation. Of course, then you can go about your way. When you get a positive result, you'll also get a message from the Department of Health asking you to respond to the nature of your symptoms and asking you 8 critical questions, so we can understand whether you need any further medical clinical support to manage your symptoms or to manage your ongoing care. The majority of people respond to those SMSs really quickly. I'm really grateful to those many thousands of people who are now every day getting those messages and responding quickly to them, because it allows us to help prioritise and target those people who need that extra bit of support. So if you're getting those messages, please come forward and get those responses out there, and we can continue to provide the right care to you, but also to prioritise care to those who need that extra bit of support. In terms of our laboratories, I'm afraid that today 4 of our private sector laboratory partners have confirmed that they are temporarily suspending a number of their testing centres. So the testing centres at Foresight, ACL, Melbourne Pathology and Dorevitch, who between them run 54 testing sites, largely smaller testing sites across Victoria, those sites will be suspended for the coming days. 41 of those sites are run by Foresight. Let me start by acknowledging the huge amount of work that those pathology colleagues have done and partners have done over many, many months, really over the last 2 years, and the intense work that they've been under over the Christmas and New Year period. They will continue to work 24/7 to process the backlog of tests that they've built up over the last few weeks, and it's in all of our interests that they get on and complete those test results to ensure that people wait for those results can get them more quickly, and then when they're ready to, they will reopen their system. Let me also reassure all Victorians that 206 state-run testing centres remain open. We will continue to run and operate our full testing network over the coming days, over the weekend and over the days and weeks ahead. And of course our staff, our hard-working staff, continue to be there to ensure people can get their tests done. We can get those results into both the private labs and into our public sector network, and we'll continue to work as fast as we can to get results through to people. I appreciate, of course, that for all of us, these are really challenging times, and we're entering a really challenging month as we face into a far bigger wave than we've ever seen before, and it's a wave that the rest of the world is also experiencing. If you have symptoms, we're going to ask you to continue to try and get a PCR. If you can't get a PCR test, then please isolate until such a time as you can. If you've got a positive RAT result already, again, if you can't get hold of a PCR, then again, isolate, treat it as a positive result. And if you need extra medical clinical support, please contact your GP or contact us via the various coronavirus website numbers that are available on our system. It's really important that you listen to your body and you listen to your symptoms and act accordingly, as we now see such a high level of transmission across our wider communities. As we've confirmed over recent days, we're expecting the first shipment of our 34 million rapid antigen tests into the state systems in the coming days, and we'll be communicating about how we deploy those. Some of those deployments will be starting to happen in the next few days, and we'll confirm that when we have the full order in our hands and we can start to act with confidence in that environment. So it is a challenging time for all of us, but what is wonderful to see today, in particular as we open up our state clinics again for the third dose booster campaign, the phenomenal response we've seen from the Victorian community. Here at the Royal Exhibition Building, one of 37 state clinics open today. We're seeing queues out of the compound all the way to Johnson Street, and it's been fantastic to see the number of Victorians coming forward to get those all-important boosters. There are today 2 million Victorians eligible for their third dose booster now. Over 600,000 have already had their booster doses. I expect to see those numbers increase significantly over the days ahead. It's really important now, get onto the website or come to one of our walk-up clinics, go to your GP, go to a pharmacy. Please make sure you get your booster dose as soon as you're able to do so. It is 4 months from when you had your second dose, which means that anybody who had their second dose completion before September of last year is now eligible to get their booster dose. Beyond that, we need to continue to work together as a community. The public health measures we have around wearing masks indoors, around doing as much of our activity as possible outside, and just being careful about the interaction we have with people in closed spaces will help us to slow down the rapid rate of transmission we're seeing at this point in time. We need to do that because the number of cases that we expect to see in hospitals have already increased significantly over the last 10 days, and we expect to see those trends continue. So the more that we can reduce down that rate of transmission, the more we can get Victorians vaccinated, the better we will be in terms of managing our healthcare systems and the hard work that Abby and her colleagues have to do over the days and weeks and months ahead. With that, I'd like to give Abby some time just to share her experiences as a neonatal intensive care nurse, and like so many of her colleagues, at the very sharp end of dealing with this health pandemic. We've been dealing with that, Abby and her colleagues have been dealing with that for the last 2 years, and we know they've got many months ahead of supporting all Victorians to maintain their health and to get back into the community. Abby, I'll hand to you. Thank you.
Hi, my name's Abby and I'm a neonatal nurse at the Royal Women's Hospital. I decided to become a neonatal nurse well before I finished my degree, after being influenced by my family's commitment to foster caring vulnerable children for many, many years. As I grew up around these children who had multiple conditions, unwell, etc. And that made me want to play my part in protecting and supporting both these families and these babies through what can be a really stressful time. As a NICU nurse, we look after the most extreme prematurity and unwell babies within an intensive care environment. It is really important for me to provide the safest environment for these babies to ensure that they can recover and grow strong and be able to go home. With COVID circulating, the best thing that I can do to protect them is to get vaccinated. I had my 2 vaccines last year, and I'm today due for my 3rd dose, and I'm really pleased and excited to be getting it today, as I want to protect our most vulnerable who can't get vaccinated themselves. I also want to protect myself and my loved ones, and I know the best way to do that is by getting my third dose to prevent me and my loved ones from any serious risks that COVID can pose. Getting my third dose is part of caring for my patients as well as my family. Fortunately, we have not had a COVID case in our NICU at the Royal Women's, and I want to keep it that way, as do everyone else at the ward. And we can do that by staying up to date with our vaccinations. That is my biggest motivation to be getting the dose, to continue to protect these babies, and not only protect myself, my colleagues, but to protect the tiniest babies that we have here in Victoria. Thank you.
Jerome and I are tossing the coin. Who do you want first? Oh, thanks, Paul. All right, let's who wants to fire away?
I'll go.
Yep.
I think the question that I guess it's unrealistic, a lot of people are asking today because they're anxious about case numbers.
Yep.
What's the likelihood of any new restrictions if case numbers keep track at this rate over the next week or two?
Well, I think it's important to acknowledge, yes, today's case numbers are high. Importantly, those hospitalisation numbers are remaining stable, and that's a key metric that we're keeping all a very close eye on. It's also, I think, some time ago now, the modelling that was released and provided did show that it was about at this time, during this January period, post-Christmas and New Year, that there was an expectation that there would be a higher number than we've experienced of COVID cases in our community. And that's exactly what we're seeing happen here in Victoria and indeed right around the country. And so we know that there are existing measures in place and existing steps that are in place that Victorians can take to protect themselves and their communities. And you know, we're all wearing masks, obviously indoors, but more and more mask wearing outdoors. If people choose to wear their masks, that is a big contribution that can be made. Getting vaccinated. We've talked a lot already this morning about the third doses and the eligibility for the third doses and people turning up from today to get their third dose. That is a critically important role that individual Victorians can play in helping to protect them and help manage the spread of this virus. Those measures and other very sensible common sense measures that we've got in place will continue to play an important role. The public health team will continue to monitor, obviously, and indeed everyone, I think, in the Victorian community is monitoring very closely the case numbers and the spread of the virus and taking individual actions. And we'll continue to look at if there are any other common sense measures that can be taken. Those are obviously matters, I should stress, for the health minister to make, and he'll be considering, you know, that's a matter for him to consider as we monitor very closely what's going on in the Victorian community at the moment.
Is there a concern that people will die at home? I mean, some people are at home, they can't get a RAT test or a PCR test, so they can't access care because you can't go to a GP without a COVID test. So are we, you know, what's our worst case scenario? Are people going to actually lose their lives at home?
Well, look, I think it's important to note that as across the Victorian government response, the system that we're responsible for in our hospitals and in our vaccination centres, we've been working really hard to prepare for this increased number in cases, and that's why there's extra bed capacity, extra system capacity, more staff, more equipment, PPE and other hospital equipment that's being made available. But there's no doubt that there is additional pressure on our hospital system right now, and indeed on our health system as a whole, whether it's hospitals, GPs, pharmacists. There is reports of the system working through the unprecedented number of cases that we're seeing around the country, and we're working very hard, as Jerome has just mentioned. The first batch of the 34 million rapid antigen tests that have been ordered by the Victorian government are on its way. We will continue to see the large number of vaccination spots available here at our state-run centres. So we will continue to monitor very closely and continue to scale up our resources where appropriate to support the Victorian community during this time.
But there is no doubt what Emily said could be happening under the current circumstances. People can't get any answers because of the long delay. So is there a concern people will die at home.
Look, there's obviously a concern about how we continue to support the Victorian community through this period of time, and clearly if people are quite unwell, reaching out to their GP is often everyone's first point of call when people are experiencing symptoms or unwell, and we need to continue to follow those important steps, contacting your GP, talking to nurse on call, making, if people do have those symptoms and want to get a PCR test, those tests are available. But we do need to continue to make sure that we are providing the support for our hospital system to work and support our sickest of patients, and that's exactly what we've been doing in scaling up and preparing for this current increase in cases.
You said before that you had been warned, or there was modelling that this could happen. Why did we not improve all the testing and the ability to do the pathology if we knew the modelling was this scenario?
So we have, as you're right, you've acknowledged, we have been preparing for an increase in case numbers. There's no doubt the case numbers have risen quickly and rapidly, and that has put pressure on both here, New South Wales and the rest of the country, and the pathology testing capacity to respond to that. That is why before Christmas we placed that order for 34 million rapid antigen tests to supplement the testing program. Now, I'm not sure if Jerome wants to add to that. He did already in his comments just now talk about those pressures on the testing system and some of the challenges it's facing, and that's why we have worked very hard to secure those rapid antigen tests. They'll be deployed in coming days, and most importantly, we're focused on deploying those rapid antigen tests and making sure that they're free and widely available to Victorians who need those rapid antigen tests.
But that's not happening at the moment. If you knew this was what the modelling had indicated, we still haven't been prepared enough, have we? Because we've got this situation at the moment where pathology's not coping, rapid antigen tests are not coping.
Well, I would say that we have responded. We have put additional resources into our hospital system, extra equipment, extra staff, making extra capacity available. There has already been that order placed before Christmas for those 34 million rapid antigen tests, and the Victorian government had to step up to the plate and put in that order in the absence of the federal government of a nationally coordinated approach to rapid antigen tests. It's not just Victoria that is wanting to secure additional rapid antigen tests. Every state and territory government around the country, and indeed just about every jurisdiction around the world, is in the hunt for rapid antigen tests. We've been able to secure 34 million rapid antigen tests, that the first batch are on their way, and we've had to step up and do this in the absence of a national approach. It would have been far better, far more productive, far more coordinated, because it wasn't just an expected spike in cases here in Victoria that was anticipated. It was expected around the country. That's why we moved in the absence of action from the federal government to get those rapid antigen tests, and they're on their way.
What is the government hoping to raise?
Sorry, Mitch, I didn't quite hear that.
What's the government hoping to raise in National Cabinet?
Well, look, National Cabinet's obviously meeting, well, as announced by the Prime Minister, it's meeting tomorrow. The agenda is still to be made available, I understand, to the states. That'll come through over the course of today. I think it's fair to say conversations like the availability of rapid antigen tests, making sure that we've got that continuing confidence from the Commonwealth about the supply of vaccines, both for the adult population and next week for kids as well. So those will be issues, no doubt, that will be discussed at National Cabinet tomorrow.
Would Victoria support a proposal to scrap VST on that?
Oh, well, look, we're having a look at that, and we're happy to have a look at that. But really, let's see this for what it is. This is a secondary issue. It's a secondary issue that's been put out there by the federal government in absence of national leadership on the actual main issue with rapid antigen tests, and that is the supply of rapid antigen tests to this country.
Emily.
Sorry.
Emily.
So what sort of pressure does the closure of those 4 private pathology testing, is it the testing sites and pathology labs, or is it, can you just explain, sorry?
Yeah, no, so let me be clear on that front. So look, I think firstly the 4 private pathology labs, Foresight, Dorevitch, Melbourne Path and ACL, do a significant amount they're a significant part of the overall pathology capacity here in Victoria. They account for around 3/4 of the tests that are processed in our labs. Their labs continue to work 24/7 to deal with the backlog that they've accumulated over the Christmas and New Year period. A huge part of that backlog, of course, was around the 250, 300,000 travel tests that were being processed right up in the run-up to Christmas and New Year. That's all helped put them behind where they need to be. That's why so many Victorians are now waiting for the test results to come through. They've made a decision to stop their testing centres, so not to receive any more test results from their own testing centres, the 54 that I referred to, and to focus on processing the lab results that they've got. We are continuing to run the 206 state testing sites. Those testing results go to a range of different laboratories, including around 11 in the public sector who work in our hospital labs. They're continuing to work 24/7. We'll continue to enable people to get access to the testing system. And to the earlier questions that Nick and Paul raised, look, there continues to be access to the PCR system. Let's be really clear about that. There are PCR testing facilities open today, every single day. They've been open all the way over Christmas and New Year. I would urge Victorians to make sure that if you're going to go to a PCR testing system, you need to ensure that you're symptomatic and that you have a good reason to go. We do not have the bandwidth, we do not have the discretion to be offering travel tests or various other tests for people to reassure themselves that they're still okay. That's what the rapid antigen testing system is now for. I appreciate there are shortages in the commercial supply market for rapid antigen tests, and that's why the state's bought 34 million of them, and we were the first state to move into that market a couple of weeks ago, but inevitably these things take a bit of time to come through the system.
Swabs from the state-run centres are still going to those private pathology labs?
Swabs from the state-run system will go to both our own public sector labs in our hospitals, and some will go to the private labs, that's right.
Why are PCR tests so far down? We had 80, close to 80,000 in the week,
Yeah.
75.
Yeah.
We had 44 yesterday and 60
Yeah.
today. That's half the amount of tests, much more virus in the community.
Yeah, so this reflects, Paul, the work that the labs are doing in catching up on the backlog of tests they're processing. So the 60-odd thousand test result number we reported on today is a number of test results that were delivered in the last 24 hours. So the high positivity rate means that we can no longer batch our samples in the way that they normally would. We're having to therefore test all the samples individually as they go through the labs. That reduces their throughput. That reduces the number of test results we can turn around in a 24-hour period. We will continue to see a lumpy profile in the number of test results coming through, recognising that some of our labs are dealing with pressures that are increasingly common to all of us, which is that as key members of staff are becoming close contacts, as they're coming positive, key gaps are emerging, and that's causing inefficiencies in their own processes. Again, we're doing what we can behind the scenes to even that out.
Have you been told have you been given estimates of what the real numbers could be? Would you share with us?
The short answer is no. I mean, I think there's a number of informed commentators putting out various assumptions around this, and this is something we've seen around the world over the last 2 years, where testing numbers, or where the positivity rate is incredibly high, and certainly where the positivity rate goes beyond 5 or 6% of samples, recognising we're now at 25%, you get a very strong sense that you're probably under-testing the overall community impact of cases out there. So we would expect there to be far more positive cases out in the community, either people who are not yet coming forward to get tested, or those who just can't get into the testing system in a way that they think is acceptable. So our message to everybody out there is we all need to be aware that Omicron is sweeping through our community now in a way that we have not seen in the last 2 years. This is not moving like Delta, this is not moving like Alpha, let alone the original variants we're dealing with 18 months ago. This is a very different beast. It's moving very quickly. 30-40% of the cases that we are seeing are amongst people in the 20 to 40-year-old age group, and I'm sure most people listening to this or who will read the reports of this will all be aware of people in their social circles, particularly in those younger age groups, who are being impacted by this. At the moment, the vast majority of people are reporting relatively mild symptoms. That is some saving grace, but the sheer number of cases we're seeing is putting and will put increasing pressure on our overall hospital system in the weeks to come.
Can we just clarify one thing? The 54 private sites that are now suspended.
Yep.
Is that all private sites? Is that all private sites and the only ones that are actually taking people at the moment are the 206
Yeah, that's right, Nick. So the 54 sites are owned by the private pathology operators. They've closed those. The 206 state sites, which are run by a combination of our health services, our community health centres, the state retail centres, the whole range that are out there. Full details are on our website. And again, use the map on our website to work out the testing centres available nearest to you. The waiting time estimates are on those websites as well. I was in one of our sites again yesterday. Again, the teams are working phenomenally hard to push people through, including the teams in those private pathology labs. I know they'll be, they're disappointed to have to do this, but they're doing a pragmatic thing in order to safeguard their system and to make sure the labs can get back on top of their workload.
Have you clarified the technical issue regarding the booking online for the kids?
Oh, yeah.
Have you clarified when that is now going to come on and what was the problem?
Yeah, so very frustratingly, so let me confirm for all those parents looking to book their 5 to 11-year-olds in for vaccinations as of Monday, and I know there's an acting premier who's amongst that group. The clinics will be open on Monday to start that vaccination program, and I know the GPs and pharmacies who are part of the rollout of the 5 to 11-year-old program are also ready to start on Monday. We're hoping to launch the online booking for the state systems today. The team detected a coding error in the system yesterday. That is being fixed today, being retested this afternoon. We hope to be able to announce in the next day or so when we can open up that system with confidence.
Just on trying to understand the true number of cases.
Yeah.
It's pretty obvious we need to move to a system where RAT
Yep.
tests result on the upload.
Yep.
When will we have that? Do you know when that?
So we'll announce in the coming days when again we've got that confidence of supply around rapid antigen tests, recognising that we're expecting shipments from the international market. There are always some risks around that, so we want to be absolutely sure once we have secure line of control over those rapid antigen tests, so we can deploy them with confidence through the state testing system, recognising again we've already made a commitment that through the state system those tests will be accessible to those who are entitled to them free of charge. That'll include the launch of an online system that will allow people to report their positive test results from rapid antigen testing, and also to use that to ensure they become part of our wider COVID Pathways program so they can access and get triage for medical support should they need it.
So this week,
We'll announce that in the coming days, Paul. We are keen to do this as much as everybody else is. I'd love to be able to do it today, but I need confidence that we've got the supplies of rapid antigen tests in our hands before we can do so.
Does that mean that the system itself is ready, you're just waiting for the supplies?
There are a whole bunch of pieces that are being brought together around this, which includes the delivery of rapid antigen tests, the distribution networks through our state clinics. There's a number of other sites that we're also working on to make sure they're available, the staffing around that, and all the management around that. So there's a number of pieces in play. They're all coming together well. We'll make announcements in the next few days.
What's your advice for people who can't? So that's obviously they're very symptomatic. They can't get a rat. So before you
Yeah.
get to the point of going
Yeah.
to a PCR test, what's your advice for them? Can they do? I mean, obviously they isolate. But
Yeah. Yeah, look, I mean, it's a great question. We touched on some of this yesterday, but it's always worth reframing. So if you've got symptoms today, number one, we'd like you to go and check on the website and see whether the nearest PCR testing centre to you is accessible to you and whether you can get in there. And again, you may expect, I think yesterday the average turnaround times were around 70 to 80 minutes. I'm sure there'll be similar waiting times there today, but check those waiting times and be prepared to wait. I know that's not what anybody wants to do, but in terms of access at the moment, that is a reality, I'm afraid. If you can't get to a PCR testing site or the waiting times are just prohibitive for you, we need you to isolate and really start that counting for yourself in terms of monitoring your symptoms. If you're concerned, please contact your GP. Let your GP know that you are experiencing COVID symptoms. They may all have further advice for you in terms of how to manage your symptoms and what you can best do. If you're able to ask a family member or a friend to get to try and find a rapid antigen test for you, again, we'd encourage you to go and do that. If you can get hold of a rat kit, then of course, please use that to, again, get confidence as to whether that's giving you a positive or negative signal. So there's a number of things you can do, and don't stop trying. What we really urge people to do is to say, well, don't just kind of go, well, it's all too hard, I'm just going to assume that I'm okay and carry on running around the place. That is how we see these kind of numbers continue to explode. And all of that downstream, it may not be a problem for you if you're in your 20s or 30s, it may well be a problem for people, members of the community who are older or frailer or have other symptoms.
Last question.
Do you just, how close are we now to this whole thing being out of control?
Oh, look, I think as always with this entire pandemic, it is in the hands of all of us as a community as to how well we manage our way through this. So there's a huge amount of work going on within our hospitals to create capacity and space to manage those patients we have today, the 516, and to manage the patient numbers we expect to see in the days and weeks ahead. We will not stop driving at that to make sure that we'll do everything we can to protect our healthcare system. We've got a testing network that continues to operate. I appreciate the testing times are longer, the delays are longer. We all have to adjust our expectations and manage around those expectations over the days ahead. and we've got access to vaccination. If I look at the response from the Victorian community here at the exhibition building, and I see the queues around the building to get vaccinated, that is all part of the response we put in place, and it's very encouraging to see. So there's a lot we can all do. It's within our controls collectively as to how we get ourselves through this over the weeks ahead.
Can I just ask, is the Premier coming back for National Cabinet tomorrow, or...?
Yes, as he has.
Sorry, just on Emily's
Yeah, Mitch.
report, for people that have done a positive rat test that are feeling to run while they line up in PCR queues,
Yeah.
what's the advice for them in their household contacts as well?
Yeah, so in terms of if you've got a rat kit and you've returned a positive rat kit, you should assume that you are positive. If you can access the PCR system, that would be my preference. I'd encourage you to do so and to try and to do so. And our PCR, our teams at the testing sites will be very keen to see you. If you can't get to a PCR testing site on the day, treat yourself as positive. Inform your work colleagues or your employer that you were positive if you're in that environment recently. Inform your friends that you're positive so they can take appropriate action, and isolate for that 7-day period. Let your GP know and make sure you've got everything around you so you can isolate safely.
So household contacts should also assume that
Yeah, that's right, yeah.
Just also on kids vaccines, how confident are you of getting your kids vaccinated?
I'm very confident. I mean, the only variable we have at the moment around the children's vaccination program is ensuring that the paediatric version of Pfizer is due to arrive. I'm getting every reassurance from the team led by General Froome that that'll be the case. We've got all the GPs and pharmacists up and running. We of course have provided some additional grant funding to encourage them to open up additional clinic time. We've got our state clinics up and running. We've got a really wonderful program that's being set up as we speak. The booking lines will open in the next day or two to allow people to book in advance. And I know many parents will be very, very keen to get their children vaccinated so they can join the rest of us and face the future with a bit more confidence.
What's the advice for principals if kids can't or won't get vaccinated before school starts?
Look, I think at this point in time, the focus. I think there's a real focus over the coming weeks to make sure that children and their parents, more importantly, take advantage of this opportunity to get kids vaccinated. I think, given what we're all seeing around Omicron, it will be hard to believe there'll be many parents who would refuse to take advantage of that proposition. We'll deal with the Term 1 settings when we're a bit closer to schools reopening.
Can we ask the Acting Premier a couple more quick questions, please? There are reports, particularly in regional Victoria, but right around Victoria, that the staffing levels are now so bad, given so many people being off, that even those who are symptomatic are being asked if they've got negative to come and work. You heard those stories, and how concerned are you about the staffing levels?
Just to be clear, Nick, you're talking about hospital settings or more broadly industry
yeah,
settings?
I'm talking about health.
Yeah, sure. Yeah, well, they've seen those reports, and I think obviously health services are managing very carefully the staffing arrangements. And again, I think Jerome and the Health Minister went to these issues yesterday about some of the changed arrangements for the furloughing of healthcare staff. And it goes back to those earlier questions about the preparedness of the health system to manage this current spike that we're experiencing. And there has been a lot of work go into ensuring that staff are well supported. It's also important to remember that our health staff have been working flat out, not just for the last couple of weeks, but for the last couple of years, both doing their regular job in terms of running a world-class hospital system, but at the added pressure that COVID has put on our hospitals, on our GPs, on our pharmacies, and then the added roles that staff have had to do, particularly nurses, at testing and vaccination centres. And so that's why we're carefully working through. I know the Health Department, the Health Minister is working very carefully through with all of our hospitals, their availability of staff, because obviously that's a critical factor in terms of managing some of the pressure that our health system is under. But it is also goes to some of those changes that was announced yesterday.
And can we ask you, you say the Premier, you believe the Premier's coming back tomorrow. When is he due back full time, and is he going to come back early? Because
so in terms of the Premier's future return to work arrangements, I'll leave that for the Premier to comment on, but he is, as he has both last week and before Christmas, he is coming back tomorrow for the National Cabinet meeting that has been scheduled.
And can we ask Abby a couple of quick questions?
Sure.
Oh, someone.
Sure.
Do you know how many cases in hospital right now are Omicron?
No, there's, as the figures I gave you before, there was, from memory, 516 or so cases in hospital, 108 in ICU. That's importantly, they've stayed stable, but in terms of the numbers that are Omicron, I don't have that information. You want to go to Abby? Yep.
A couple of quick questions. Abby, just from your experience working through COVID and now,
Yeah.
how much pressure is there now on staffing levels and on staff?
Yeah.
Not just in areas which deal with COVID, but right throughout the hospital.
Yeah, it's definitely having a bit of an effect. I mean, I can only speak personally and from conversations with fellow colleagues and friends that also work healthcare, but we're definitely feeling a bit of a push at the minute and getting, I guess, tripped up with whether we've had an exposure or whether we're a little bit unwell. We, of course, don't want to take that into the hospital. So I think there definitely is an increase in the demand and feeling more short-staffed than any other time over the last 2 years. So I think that, yeah, it's exhausting, and of course I feel we are all short-staffed, and although, you know, in the NICU world we are quite protected at the minute, we have managed to keep, you know, no cases with our patients, but all of our staff are obviously still very exhausted. We are getting exposed ourselves, or, you know, whether that's at work or out socially, it's definitely taking a toll more than it has the last 2 years.
And how do you cope with that?
Yeah, good question. I'm still trying to figure out how I cope with that myself. I mean, at the Women's, we've got an amazing support team, and they give us great guidance as to how to isolate or do whatever we need to do when we can safely come back to work, which is fabulous, and I'm sure most healthcare facilities are doing that very well. At the minute, I feel that amongst my friends and my work colleagues, we kind of all chat about it. We kind of bounce ideas off each other, kind of say, you know, I was exposed here, and then we go, right, well, maybe you shouldn't go to work, or contact that person. I think it's a lot of internal support at the minute, and just making sure we are staying up to date. And also, I know I'm limiting my exposure to other people at the minute, just out of the fear of not wanting to contract it and take it into work. So I think it's just more being cautious about what I do, who I see, where I go, which has definitely been a big thing over the last couple of weeks with being in the holiday period. Yeah.
Can we have your surname, or do you prefer not to?
No, that's fine. I'm Abby Gallop.
Can you spell that, please?
Gallop, G-A-L-L-O-P. Abby, A-B-B-E-Y. Gallop, G-A-L-L-O-P. 24.
And no mosh pits for you then?
Sorry?
No mosh pits for
No, not this year. Definitely not. Thank you.
All right, all good.
Thank you.